If I can start with the daily update, there are 1,494 cases of coronavirus in Victoria. That is 7 more than yesterday. One of those 7 is connected to the Cedar Meats outbreak. 4 are connected to overseas travel. They are return travellers, and 2 of those cases are still being investigated. We have, over these last 2 weeks, I want to start by saying how grateful and how impressed I am that 161,000 Victorians have come forward to get tested. It is a mighty effort, and I'm so grateful that we asked people to do that, and they have absolutely come forward in record numbers. This is by far and away the biggest testing program that our state has ever seen, and it's one that gives us options that we will act on today, and I'll come to that in just a moment. But those 161,000 Victorians, thank you so much to the lab technicians, to the public health team who have been taking those tests, processing those tests. We now have 141,000 of those 161,000 tests processed, and we can say that there are 30 cases that we simply didn't know about before those tests were conducted. They're not connected to an outbreak, they're not connected to overseas travel. What that tells us is the virus is still with us. The virus is in the Victorian community, and it was the right thing to do to go and do that massive number of tests to confirm that, to basically show us that whilst the numbers are stable, there is a real need to be cautious. There is a need for us to take a small first step and all be vigilant in following a new set of rules. This is not over. I wish it were, but it is not over. And whilst we won't necessarily be doing 161,000 tests every fortnight, testing will be a feature of each day, each week, each month for the rest of 2020. So, what I want to do now is take you through the first lot of changes we will make to these rules. The first safe, cautious and appropriate step towards getting back to as normal a life, as normal a Victoria as we can hope for, until of course we get a vaccine for this virus. So, as you know, we have been asking Victorians to stay at home, and we've said there are 4 reasons to leave your home. We are adding a reason, we are adding a 5th reason, and we are changing one of those 4 reasons. Essentially, from 11:59pm tomorrow night, Victorians will be able to have 5 guests to their home. They should be family and friends. After all, they're the people that mean the most to us in each of our lives, and that's where it's really hurt, I think, people not being able to connect with the people that are most important to them. So from just before midnight tomorrow night until the end of May, this next period will expire just before midnight on the 31st of May, so about 3 weeks' time. You will be able to have 5 family and friends come to your home. The reason it's family and friends is twofold. It is the group that's most important to all of us, and secondly, if there are outbreaks, we need to participate in outdoor activities, sports activities, recreational activities, whether it be hiking, fishing, playing golf, going for a walk, kicking a footy. No more than 10, and there'll be obviously physical distancing and hygiene arrangements, common sense basically. The rules that have been in place to this point remain in place. There are some further changes to funerals, to weddings, to auction houses, to real estate auctions, to religious observance, small private prayer, other similar services. Not a full mass, not a full service, but some very discreet, we think, appropriate changes made there. There are some changes also to the way a number of community facilities work. For instance, some counselling services which we believe are really very important. Some council facilities, community centres and the like run things like Alcoholics Anonymous meetings, things of that nature, counselling and other really integral and important community meetings. They will be allowed, but again, no more than 10, and there will be physical distancing and all of those other usual arrangements. Nothing changes there. You've got a list that takes you through all of those changes, but the headline is you should still stay at home unless you are going out for one of those 5 reasons. The 4 everyone knows about. The 5th reason is to visit family and friends, but no more than 5 visitors can go to somebody else's home. On work, I would ask and encourage people, if you can work from home, you must work from home for the rest of May. Some people have not been able to do that, but a very large number of Victorians have been able to do that. I'd also say, whilst it is now allowed, or from midnight tomorrow night it will be allowed for you to go and have dinner or a visit with family and friends, that doesn't mean, and it is not an invitation, to be having a dinner party at every house every night. We have to use our common sense. We have to be proportionate. We have to recognise that this is far from over. This is an opportunity for a first step that is safe, cautious and appropriate. And that's what's most important. Now, just finally, before I ask Jenny to add to my comments, and then we'll take any questions you have, all three of us are happy to answer any questions that you have. I want to speak a little bit for a moment about schools. We have been doing a power of work, and we're very close to finalising a plan to see face-to-face learning return before the end of Term 2. As you know, we had, for the purposes of certainty, said to parents right across the state that they should plan and assume that learning from home would continue for the entirety of Term 2. We now believe that a gradual, staged return to face-to-face learning is safe, cautious and appropriate given the testing we've done and the circumstances we face. Today's not the day to announce the details of that. I don't want to make announcements and then not be able to answer all the questions that you rightly will put to me, but that'll be done soon. And we'll give parents lots of notice. That's exactly what they have asked for. We've been working very closely with teachers and staff, with principals, with parent community, right across the board. And we're very close to be able to make some significant announcements on schools. Overall, you only get one chance to take this first step and to do it properly. This is safe, this is cautious, this is appropriate. We're not other states. We face our own unique challenges and we need to be appropriate to those. We need to be cautious. I think it is also worth mentioning, before I throw to Jenny, that professional sport, after all, it is a workplace. There's been a lot of work between, say, the AFL and the public health team, and we will be able to. We have agreed to a set of arrangements that will allow training for AFL, for rugby league, for other professional sports to resume from just before midnight tomorrow night. Of course, with that happening, once training is up and running again, that paves the way for the AFL and other codes to make announcements. So training resuming paves the way for footy to be back. And I think we all want that, provided it's safe, appropriate, and can be done in a cautious way, and I'm confident that it can be. So these are small steps, significant steps though. You only get one chance to get this right. The last thing we want to do is follow the example that so many other countries have given us. If you relax too many rules too quickly, then we will find ourselves back here, and indeed worse. We will find ourselves in a lockdown even harder than the one that we are now coming out of. Our numbers, our performance is the envy of the world. We need to make sure that we jealously guard that we are cautious, that we are safe, that we are appropriate in any easing. Of course, June, following more testing, following the experience of these 3.5 weeks, that will guide us, and we'll have more to say at that time about cafes, restaurants and a whole range of other issues. We've been guided by the data. I'm so impressed to think that so many Victorians have done the right thing, that so many Victorians came forward and got tested. We are in this together. We can all be proud of the results we have been able to produce, and we all need to have that shared commitment to keep following the rules so that we don't give back all the great progress that we have made. Thank you to every single Victorian. And now I'll ask Jenny to add to my comments.
Thank you, Premier, and good morning. I too want to take this opportunity to thank Victorians for coming forward and getting tested as part of the testing blitz. When we started the testing blitz, we aimed to analyse 100,000 Victorians' testing results. In fact, we smashed that. We have now analysed more than 140,000 testing samples, and as a result of that, we found 30 Victorians who were walking amongst us, potentially spreading the virus to others who tested positive. And I want to thank those individuals. I want to thank the 161,000 Victorians who came forward as part of the testing blitz, who have helped us to understand the level of transmission we have in the community. So those 30 individuals may have spread the virus to others. They're now required, of course, to self-isolate, as is always the case with positive cases. But it has told us one thing, and that is that this outbreak is not over. This pandemic is not over. What is going to be necessary is continued vigilance and continued surveillance. So today we are announcing a $20 million package of measures to enable further testing, contact tracing and responses to outbreaks to continue. And these are important preconditions that we have put in place to enable an easing of the restrictions to occur. We're going to continue to do as much testing as possible in the community. We have set ourselves a target of a further 50,000 tests for this week, and we are aiming to test another 150,000 Victorians by the end of May. That will mean that we can continue to monitor the situation and see whether we are able to do any further easing of restrictions into June. So we will continue to be testing and analysing that data for the rest of this year. We're also going to be doing more analysis of our sewage samples to make sure we are across whether we might have unknown outbreaks in different parts of the community right across Victoria. So that is part of that contact tracing process as well. And most importantly, we know that any easing of restrictions may well mean we will have further outbreaks. So we need to be able to respond to those outbreaks as quickly as possible. This is why a dedicated outbreak team is now going to be established in the public health team in the Department of Health and Human Services. As part of that, they will have rapid response squads that will go out and be able to address issues with business, with workplaces, with schools, with health services and others as required. And they will also be doing risk assessments, working with high-risk industries, making sure they can give them proactive advice in a preventative sense to prevent outbreaks happening in the first place. The final part of today's announcement is of the $20 million, there is $8 million for more medical research. Now, we said right at the outset that this is a new virus that's been introduced to Australia that's come here from overseas. There's a lot about this virus that we still don't know, and we are learning more about it every day. So this $8 million funding that will go to our world-leading medical researchers in Victoria is designed for us to better understand how the virus is transmitted in the community, to understand whether it develops immunity in individuals, and that is still an issue that is open for debate in the scientific community, and also finally to understand whether this virus leads to long-term health consequences for individuals. So we will be supporting our medical researchers to help us to better understand this virus, and of course we have already provided funding to them to work on a potential vaccine as well as medical treatments for the virus as well. So this total package is going to be part of our continued efforts right throughout the year to do more testing, more contact tracing to respond to outbreaks as they occur, and we will continue to be vigilant. We ask the Victorian community also to be vigilant. If you have mild symptoms, those mild cold and flu type symptoms, please do not ignore that. We have picked up cases as part of those 30 individuals who had either no symptoms or very mild symptoms, and they tested positive. That meant that they could have passed on that virus to their family members, to their loved ones, and of course to the broader community as well. So it is important, if you are feeling unwell, that you get tested, come forward. We will continue with 5 metropolitan and 3 regional drive-through shopping centre testing clinics. We will continue also to move those mobile testing clinics around to to different parts of the state as required. So we encourage people to continue to be tested either through those mobile screening clinics or through a public health service screening clinic or through their GP. Please, we thank Victorians, of course, for stepping forward and being tested, but please come forward if you have any mild symptoms at all. This is how we are going to be able to accurately monitor the spread of this virus in our community. Thank you.
We're happy to take any questions you have.
How far can people travel to go to one of these outdoor?
So there's no overnight stay. So there's no camping, for instance. There's a number of national parks and state parks that will reopen as per the list we've given you. Not every one of those current experiences that have been closed can be reopened, and we're providing some further advice on that. Not every one of those can have the 1.5 metre distance. You can't socially distance in some of those areas, Buck and Caves, for instance, just to give you one example. We've never had limits on how far a person can travel. We've not closed our borders. We've not had internal borders, and we're not changing that. The fact, though, that people cannot stay overnight, I think will limit how far they travel. But if you want to drive to the beach to have a surf, or if you want to go and visit family and friends, then you are able to do that. Again, I'm just asking people to use common sense, good judgment. This is not an invitation to be out visiting family and friends every lunch and every dinner every day of May. That would not be smart. But we know and understand that in some ways, from a personal point of view, leaving some of the economic challenges and employment challenges, which are very significant, and we understand that. But on a very personal level, some of the things that have hurt most is the notion of not being able to connect with the people that are closest to us. That's why, logically, the first step, cautious, safe and appropriate to our circumstances, is to allow those groups of 5, up to 5, family and friends, to come to your home, to perhaps share a meal, to spend some time together. But again, if people use good judgment and common sense, that's an important step, but it's a cautious step. It is a first step. And if we see people continue to follow the rules, so stay at home unless you're going out for one of those 5 reasons. Work from home. All of those rules that we've now become well and truly accustomed to, if people keep following those rules, then just as we've had options to move to these changes today, we will have more and more options in June to open more of the economy, more of the Victorian community up, and take significant steps towards a COVID normal, something that approaches much closer to a normal Victoria than any of us have experienced for many weeks now.
So just to clarify that, you can't stay at the property, but can you book a hotel room nearby?
We would prefer, and I don't think you'll find, Airbnb will not be taking bookings. There will not be bookings at hotels and things of that nature. We don't think that is appropriate. If you need to go and visit family and friends, then you are able to do that. But we just ask people to use common sense and good judgment. Things like camping will not be allowed. And we just think that is appropriate just for these 3 weeks. That may change in June. A number of different experiences that are not feasible now, we may find a way to be able to socially distance. There will be a gradual opening up of the economy, a gradual relaxation of these rules, but each step, and particularly the first step, has got to be cautious, safe and appropriate to the circumstances that we are dealing with, and they are different to other states.
3 weeks, you're saying 3 weeks?
Yes.
Can you move if the numbers stay very stable? Go ahead to stage 2?
No, I think everyone can assume that these new rules, and this is a significant step, I'm sure that others would like us to go further. I'll just take you through the obvious example. If you think about cafes and restaurants, my thinking here is that if we wait these 3 weeks, when we move to go beyond just takeaway for cafes and restaurants, we might not have to stick with a number of 10. We might be able to go higher than that. I won't speculate on what that number is, but I think that the feedback from many businesses is that at just 10 patrons, it's really hard to be viable. If we just wait these 3 weeks, if we do the testing, if we have that further assurance that the significant steps we've taken today isn't causing us trouble that we can't manage, then I think we can take a bigger step potentially in June for cafes and restaurants and get them to a point where they are viable. Their business model has changed. I think takeaway will be a feature for a long time. If we can supplement that and complement that with table service as well at more than 10, then there's every chance that that's a more viable business model. That's our thinking. So it's 3 weeks. Assume that these rules don't change any time in the next 3 weeks, and we will have more to say in full detail once we get to the point where we have to make decisions for June.
Could that include pubs in June?
Well, there's been other states and a discussion at National Cabinet, and we're in communication with the AHA and with others. Certainly the food part of the pub, so the space in the hotel that's much more akin to a restaurant, that's certainly something that we're looking very closely at. But at just 10 patrons, the feedback has been pretty overwhelming that that's not a model that is viable. However, we might be able to get to a different model, a larger number of patrons in just 3 weeks' time. I'm not announcing that today. That's not a given, but that's certainly our logic, and that's what we'd like to get to. But that's based on testing, and to be honest, I just say to every Victorian, it's based on you. If you continue to follow the rules, then we'll have more options. If you continue to come forward and get tested, if you continue to wash your hands, cough into the crook of your arm, all of these simple things, if you continue to keep your distance, and if you stay at home if you've got any symptoms, then we'll have more options in June, and then as the year unfolds, there'll be more and more options for us to get to something approaching normal.
Will professional sports clubs be subject to this 10-person limit, or have you made an exception for them to allow full team training?
So what we've done is said that each sport, and obviously sports are different, will put in place their own plans, but they must be self-contained. So if they're using a training facility, an indoor gym for instance, or an outdoor area, it must be exclusively for them. We can't have a situation where there's a carve out for professional sport because it's a workplace, because it's basically a job. We can't have a carve out and then have other people who are not connected to that sport intermingling, if you like. This is about containment, it's about managing a risk, and in the event that there is positive tests, we're in a very strong position to be able to contact trace and take whatever appropriate public health measures are deemed so. So this is exclusively for those professional sports, and they need to have control of the space they're in, and they need to listen to the advice of the Chief Health Officer. There's been a very positive partnership, not just with footy, but with rugby league, with other codes, and I'm confident that they understand that there are risks and they need to do everything they can to mitigate those. And to the extent that they can't, the notion of having it exclusively for that team, for that code, protects the rest of us.
Sorry, go on.
I was just going to ask about work. The Prime Minister made a point on Friday of saying that if it works for the employee and the employer, then people should start getting back to work, which obviously has a big economic impact. What's the thinking behind the stark difference, I guess, for Victoria?
Well, I'd say to you that there are many Victorians, their employers and workers who have, because of the work they do, they have been able to work from home. And I don't want to see that change in the next 3 weeks. The fact that we're going to have literally hundreds of thousands of people visiting family and friends, that's a big step. That's a lot of movement that wasn't happening previously. We have to be very careful not to do too much too soon, because the problem then is it gets away from you. We've seen just how infectious this is, how rapidly it spreads, not just in our state and our nation. I'm sure people have seen reports about a single individual attending a number of bars in South Korea. There's now 1,300 people that are basically in home quarantine, and I think something like 2,100 bars that have been closed. This thing is highly infectious. It's rapid. It's dynamic. It gets away from you really quickly, and that's why we're taking. They're significant steps, but they're cautious, safe, and appropriate to the circumstances that we face. They're different to what's happening in the Northern Territory, for instance, because they're in a different position to us. If you can work from home, you must work from home for the rest of May. Beyond that, I'd hope to be able to have a different message and move to a different set of circumstances for June. But again, cautious first steps, lots of testing over the rest of May. Hopefully Victorians, I'm confident, they keep doing the right thing, they keep following the rules, and then we'll have, again, more options in June to go even further.
Can community sport return to training?
Training, yes, subject to the 10-person rule, subject to things like, for instance, just common sense. If you are sharing equipment, you should try and minimise that. But if it's unavoidable, given the nature of the sport, then you should hand sanitise, clean the equipment, all of those quite logical things. And there's been advice there has and will continue to be. Part of the reason why we don't announce right now and have it all come into effect in an hour or so, part of the reason we have some time to work up to these new rules is to have all sorts of different discussions with different sporting bodies, different stakeholders, if you like, across the board. You can kick a footy in the park. There can't be more than 10 of you, and you should keep your distance, and it should be non-contact. And you should clean your hands when you start your kick-to-kick session. You should clean the ball and your hands at the end, and you should avoid touching your face. These are just common sense things.
Would a coach be allowed to attend that as extra to the 10? You're talking about sometimes you've got some of these guidelines that people are facilitating.
No, I think 10 is 10. And at this stage, it's for 3 weeks. There might be a different arrangement. This is mainly about training and social activity. It's not about a return to a full, Auskick program. It's not amateur footy coming back at, pace. It's cautious. It is the appropriate step for us to take. But people want to go for a hike. They want to go fishing. They want to go out in a tinny. You just can't have 10 people in a boat that doesn't allow you to be 1.5 metres apart. You might be able to play a game of golf, but there won't be rakes in the bunkers, and people won't be milling around the clubhouse, and the clubhouse will in fact be shut. The list goes on and on. A lot of this is all driven by common sense. Logic is the best guide in these things, and if you're doubting whether you ought to be doing it, don't. That's the simple message. This is not an invitation to be out every hour of every day or to be having friends over every lunch and every dinner. That's not what this is about. And if we all did that, then we'll have less options in June, because our testing program, the biggest in the country, will find many, many more positives, because nothing will happen but spread the virus. Again, we're all in this together. If we all do the right thing, then we will all benefit from more options, more easing, further steps in June and indeed beyond June.